We are here with you for another episode of Tooth Talk with the Dental Diva and Dr. Sylvia Atkinson from Jasper Dental Associates. Hi, Miss Sylvia.
Hey, Ava.
How are you doing today?
Doing great.
And what are we going to talk about today? It's always something interesting, and I always learn stuff.
Let's talk about cosmetic dentistry.
Cosmetic dentistry. Well, where do we start with that? Because there's so much involved in cosmetics, so many different things.
Someone once told me that all dentistry should actually be cosmetic dentistry, and there's truth in that. And anytime I treat a patient, I'm considering their smile, how it looks now, how they might like to have it improved, the color of their teeth, the size and shape. Even if it's a denture patient, those considerations should be taken.
And how to look in the future and, carrying them through their life with a pretty smile.
All of those things. And I like to ask a patient, if you had a magic wand, what would you change about your smile? That's a good starting place. And it can be as simple as repairing chips of teeth with tooth-colored fillings. It can be braces or orthodontic treatment, and that can be done in our office in a short-term way for adult patients. And you might have heard the trademark 6-month smiles. So we can start by talking about braces for adults. You're never too old. We've had patients into their 70s who've elected to go ahead and straighten their teeth out, and we make it faster so that it's easier for you to do. By the time you have your next checkup, your teeth will be straighter. So in 6 to 9 months with the methods we use, and we consider cosmetic, we have cosmetic considerations even with the tools and when I'm trying to remember what I need to tell you. They're called brackets. So we make them tooth-colored brackets, tooth-colored wires, so that it's not as noticeable for our adult patients.
That's what I was about to say, is there's so many different options now than, say, when I was a teenager and had the silver mouthful of metal. There's so many different options for adults that are so much nicer to look at.
Right. So in a 6-month period, you can have straighter smile, and it's fantastic. So that's one way we can do things. Another, if you're happy with the size, shape, and position of your teeth, there's always bleaching. And at Jasper Dental Associates, we try to keep that at an affordable cost. We make custom trays for you to take home, and in the initial setup, you receive bleach to take home with you. We instruct you on how to use it and any kind of side effects you might encounter. And you hold on to those trays, and you can continue to buy bleach and touch up as necessary to keep your teeth nice and white. That's a pretty simple way to go.
That is being able to take it home. That's cool, but still have the quality products that you get from your dentist.
And in our office, just recently, we're beginning to use a system called Loomis Smiles. And it consists of both veneers and crowns. And many of you might know what a veneer is. If you consider, or if you think back at a tip for a fingernail, which just sits on top of it, or a wood veneer that sits on top of a piece of furniture. It's a very thin piece of porcelain, essentially, that's bonded to the front of your tooth. And it can be a veneer or a crown, a combination of those that can really redo a person's smile and make it into what you might have heard a Hollywood smile to be. Brighter, whiter, filling in spaces, and making the teeth uniform and beautiful. And it can be done with very little, if any, reduction or preparation of the enamel surfaces of your teeth, and so you don't require any anesthetic.
Oh, that's awesome to go and have that show-winning smile
In just a matter of weeks. Absolutely. In our office, we're showing everybody what they look like today with a photograph that shows what they could look like in an idealized situation, and then another photo that might show them with a little bit of bleach. So it's a visual tool that helps you see what it can be. It's pretty exciting. Hopefully you'll hear more about it.
Yeah, and when people come in with concerns about the appearance, I mean, is the whiteness their main concern, or does it kind of divide up pretty evenly between chips and straightness?
I think that it involves all of those things. It can be positioning of the teeth, whether they look crowded and overlapped. It can be old fillings that are discolored, cracked teeth, and there will be sometimes when repositioning your teeth with orthodontics is enough with some bleaching to make a really dramatic change. But there are some situations where people just don't want to experience braces, and we can actually simulate with a LumiSmile or Lumineers straighter, wider teeth without actually moving them.
Okay, because you're kind of filling in the spots where it might need be and evening out some other spots.
There
by
may be
the
some
thickness of
addition
the-
or
okay.
some subtraction in your smile. Yes.
Okay. Well, that's awesome. I know my mother has always had not anything major, but little gaps in between her teeth, and it's always bothered her.
Exactly. A
My
lot of people are
dad-
bothered by them.
My dad will not. He refuses to let her get it fixed. He
Madonna
says it's
likes
her
hers.
and, but yeah, she likes hers as well. But it does cause her discomfort in that stuff gets trapped, more easily than if they were together. And I think that's been her main thing about it over the looks wise. And of course, some of the cosmetic stuff is actually going to help that kind of issue too. So.
Well, it can help positioning, spaces between the teeth, discolored teeth from tetracycline taken as a child, chipped and worn teeth that have lost length from use and grinding. Am I missing anything? Can you think of any other reason?
Obviously, injuries to the teeth,
Right.
where you've lost
So
it.
it can really cover the gamut of issues in the front teeth. And we can often correct some malalignment or positioning with the Lumineers and our LumiSmiles. So it can go both ways. An individual may prefer to straighten their teeth and then consider the cosmetics, or perhaps need nothing more than bleach. And on the other hand, someone might prefer to have just larger, wider teeth that give them a broader smile.
Well, now, and the with braces and stuff, the difference now as far as comfort of wear with the braces now and say 30 some odd years ago when I had the horrible and I played in the band. I played the French horn. I played the clarinet. I was constantly with huge sores where I had bumped my lip and it had mashed it down onto the big metal braces.
I think our hardware is smaller now, for lack of a better description. We bond smaller brackets to the face of the teeth and the wire sits inside, but there's still adjustment that has to take place. And especially if you're playing a wind instrument, you're certainly going to have to get used to the change of your embouchure. And I tell my young patients that that's going to be expected. But for adults, it's usually just irritation in the beginning, and they get over really quickly.
Right. Because I also know my brother played sports. He also had braces. And any small bump to the mouth meant blood and terrible sores.
He
And
needed-
so it's good to know that they're much smaller
He
now.
needed an athletic mouth guard.
Well, now he wore one in some instances, but out to just full because we had a tennis court and basketball goal on it at the house. So just going out, to play with his friends for a few minutes, he wouldn't necessarily always put that in. And I've just seen some terrible, things in his mouth and mine just from playing instruments. So it's really good to know that they're so much smaller now. Because even when I talk to a young person now who has the full braces, you don't know they do until they open their mouth and you can see it. When we wore them, you could tell before we opened our mouth that there were braces in there.
Yes, I think there's a little less bulk to them
Yeah,
today
I
as opposed
agree
to 30
there
years
has
from
to
now
be.
or 30 years before.
Yeah,
But there's still adjustments that have to be made. And, we can help out with any minor irritations. As far as athletic, safeguards, that would require something else like a athletic mouthpiece or
Right.
sports guard.
right. Which I said I know those are available, and he did wear one some, when he was out actually playing a game. But a lot of the stuff happened, as I said, at the house or in the yard or the fringe yard, and just the slightest bump would just cause so much damage. And I'm glad they don't have to suffer quite like that these days to get their teeth all pretty, because I can remember a few points thinking, is this worth it?
Yes.
That was, to me, trying to do these things and it just totally tearing your mouth up. Like I said, I can tell from talking to people that they're smaller than they were back then. And I'm sure have much more attractive options as far as mouth guards go. Because ours hung out and they were terrible,
Custom mouth guards are the best.
Yes, I would definitely suggest that. Well, let's see. What else, as far as cosmetic, do you want to touch on today?
Well, we can talk a little bit about how that plays into dentures and the results that people are looking for. Because I think that I experience folks who've gone to the same-day dental office, and I think because it's a lot of information they're trying to collect and process and then create a new set of teeth in such a short time, that maybe they don't have the chance to take their time and look at the factors that make a smile pretty. And if I'm looking at a person, I evaluate how their lip falls, whether it's their upper lip or their lower lip. And so if you look at yourself in the mirror and smile, a lot of us aren't symmetrical. You may have a smile that has the right side of your lip or smile higher than the left side. And sometimes our skeleton dictates how the teeth are attached and then appear in the smile. So even with dentures, we pay attention to symmetry and we pay attention to the curve of a smile, which generally goes up. When you smile, your lips go up, and so typically does the curve of your teeth. And where the center of your face is, that's not always the center of your teeth, but we try to approximate it. And our noses aren't always straight. Most of us have slight deviations. So there are a lot of things to consider besides just color.
Right. I mean, you want it lined up, and I would think lined up with the little divot above your lip, but more so than with the nose, because my nose goes to the left.
Most of the
bit,
time,
so.
that's true. But I really don't know if you have more questions for me in terms of cosmetic procedures or cosmetic dentistry.
Now, what is the alignment process when you're trying to get those? I mean, what do you go by? You kind of find a happy medium between the point of the nose and the divot over the lip?
Well, if we're talking about dentures, I look at the entire face and approximate the center of the entire face. I'll use a piece of floss and plumb your face so that I can see the entire center line. If we're talking about braces, in the case of the short-term adult braces, 6-month smiles, your teeth are going to open up to the natural arch form of your bone. And that it's hard for me to describe. I think here it's easier to have a visual, a model of teeth and a palette so that you can see it. But the wire allows the teeth to form along the arch of the bone. The wire itself has a memory. So when it's attached to the brackets on your teeth, the teeth move back into the memory of the arch wire. Does that make sense?
Yes.
So
yes,
it's probably a lot more detailed information than you want to know, but
so it pulls as much as it's supposed to, but gives a little bit as well.
And your teeth move.
The bone structure and all that can kind of determine where they go as well.
Your teeth are moving all the time. Right. So this is just about trying to encourage them to move in the right direction.
Well, that's a good way to put it. Now that I get. All right. Well, thank you so much for another great informative show.
Thank you,
Tooth
Ava.
Talk with the Dental Diva. And y'all can feel free to call Jasper Dental Associates. She'll give us that information.
We are at 938 West Church Street, Suite 104, and our phone number is 706-692-2611. Please give us a call.
And they're a family practice, so from your first tooth to your last.
No last tooth.
last.
We want to keep them.
All right. Thank you so much, Miss Sylvia, and y'all have a great day.